Alright, we're going to begin by stating our rights to medication, which are rights to drug, dose, time, patient, and route. So we are starting with Millie Larson. Date of birth 1/1/1936. She has no known drug allergies. And we are going to be giving 500 milliliters of 0.9% sodium chloride, so normal saline, at 125 mLs an hour, with the drop factor is 10 drops per ml. So we're going to hand sanitizer, and we are going to get our supplies. All right. So we have 500 mLs of 0.9% chloride, 500 mL 0.9% sodium chloride. It's within date. It is not expired. We got our administration set. It's not expired. We have alcohol supplies, labels for the IV tubing, and we have gloves. All right, now we're going to go see the patient, Miss Millie Larson. We've compared it to the MAR and double checked 3 times. Right? We're going to knock on the door and go in the room and provide privacy if necessary. All right. Alright, so when we get to the room, we're going to confirm Millie Larson. Millie Larson, date of birth 1/1/1936, no known drug allergies. We're going to explain what we're doing. We're going to be giving you some IV hydration of normal saline. It's going to run over 4 hours. This will just help you to be more hydrated. So now we're going to start. We're going to hand sanitize again, wash our hands. Alright, we're going to check the order again, and it is 125 mLs per hour with a drop rate of 10. So that will be 500 over 4 hours times 10. So 500 mLs over 4 hours times 10 drops per minute of 1,000 over 60, 120, 180, 240. Cancels, that goes into that. Alright, so it'll be 21 drops per minute. Alright, so we're gonna do our hand hygiene. I'm gonna don some clean gloves. We're going to use aseptic technique when we're opening up our supplies. Open. I'll throw this in the trash. And we have our tubing. Alright. So now we're going to double check one more time. 500, 500. And it's within date. So we're going to get out our tubing. We're going to scroll the clamp down. Do that. All right. Without touching the spike, we're going to invert the bag. We're going to take the blue tap off. With the bag inverted, we're going to spike and the clamp is, so now we're going to hang it. Alright, so now that it is hung, we are going to press and fill the chamber up halfway with the fluid. And then we are going to prime it by slowly releasing. Making sure we get no air bubbles. And making sure that none of the medication escapes the tubing. And twist that without touching. And none of the fluid escapes. And we'll cut that. So now our IV tubing is primed. We'll take this off, do hand hygiene. Okay, now we are going to fill out the label, which the date hung, which is 11/12/21. The time is, time hung is 17:15. It's going to go over 4 hours, so 21:15 will be the discard time. My signature, and we will put the rate on it as well, which is 125 mLs per hour. And we're going to label our bag. Alright, do hand hygiene. Gloves, and we're going to assess our IV site. There's no signs of infiltration, redness, phlebitis. The IV is patent. No pain or tenderness. Alright. Take those gloves off. And now we are going to connect our normal saline for infusion. Alright, so we will take our tubing with our alcohol wipe. We're going to scrub the hub vigorously. We're going to discard that. We're going to give it time to dry. Then we're going to connect the line. We're going to open the clamp, and we are going to count our drops to get 21 drops per minute. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, and 21. So the IV fluids are flowing at 125 mLs per hour. So now we're going to doff our gloves, do hand sanitizer. We are going to fill out our MAR for the sodium chloride. So it was given. Let's start it at 1715. Flow rate is 125 mLs per hour. Injection site, we have our right forearm, Peyton, and we will sign it, and we will initial it. Alright, and we will monitor for any adverse reactions, and we assess the site, and there's no signs and symptoms of infiltration. The patient is comfortable, and no signs and symptoms of distress. We'll provide hand sanitizer one more time, and we will continue to monitor the patient.